Okay, well, let's go ahead and get started with today's session. And again, thank you for joining today's webinar. So let's take a look at our objective over the next hour. As I'm sure most of you know by now, CMS is requiring all hospitals to post their standard charge master in a machine-readable format. We want you to walk away today with a tangible strategy that you can take back to your leadership with recommendations. And the key word here is strategy. Some hospitals will simply just post their charge master to check that box and meet the mandate. But as we will discuss today, doing just that potentially presents a huge problem in the eyes of your patients. So before we get started, I'm going to go ahead and launch our first poll question of today. And that poll question is, what is your confidence level in meeting the CMS price transparency mandate by January 1st? And the options are very confident, somewhat confident, or not confident. Again, that question is, what is your confidence level in meeting the CMS price transparency mandate by January 1st? Very confident, somewhat confident, or not confident? And we'll give everybody about 30 seconds to vote. All right, thank you everyone for voting, and we will follow up after the session with the results of these poll questions. So just some brief introductions. My name is Brad Josephson. I'm the Director of Marketing here at PMMC. And also with me today is Ashley Carden, the Vice President of Revenue Strategy at PMMC. Ashley's been in healthcare for over 10 years, and it has advised many healthcare providers across the country on revenue and price transparency strategies. Ashley is going to kick off today's sessions with the latest from CMS.
Good afternoon, everyone. You're probably aware that the pricing transparency rule that goes into effect on January 1st, 2019. But did you know that CMS also released a frequently asked questions document pertaining to this rule? We're going to be covering these today, along with suggestions on how you should respond and how to get ahead of pricing transparency. The rule states that hospitals will be required to publish their standard list of prices online in a machine-readable format, and they must update the list of prices at least annually. This statement is somewhat generic and left many with unanswered questions, but Secretary Azar's statement was very clear. CMS is looking to move the industry to a new era where patients have increased information, specifically quality and pricing, to make well-informed decisions. Their goal is to drive competition. One of the questions in the frequently asked questions document released by CMS relates to the format of the publication. CMS states that the format is to be the hospital's choice as long as the information represents the hospital's current standard charges as reflected in its charge master. CMS also made it clear in this document that the requirement to post charges applies to all items and services provided by the hospital. CMS also further defined machine readable. It's defined that the format is a digitally accessible document that can be easily imported or read into a computer system such as Excel or CSV. It specifically states that PDF is not acceptable. CMS also addressed the requirement for hospitals that already participate in a state online transparency initiative. It clarified that a state program does not exempt a hospital from this federal requirement. The last Q&A we're going to cover is, do the requirements restrict hospitals from posting quality information or additional pricing transparency information? The answer is no. CMS encourages hospitals to undertake efforts to engage in customer-friendly communication of their charges to help patients understand what their potential financial liability might be for services that they obtain at a hospital, and to enable patients to compare charges for similar services across hospitals. In other words, provide comparative charge and quality data. Next, I'm going to turn the presentation back over to Brad to give you a little insight as to what else CMS is up to that you might not be aware of.
Thanks, Ashley. And that last FAQ is really telling. Here's why. In addition to the FAQs, we've learned some more intel which may not yet be widely known. CMS has released what they are calling a source sought notice, which really doesn't sound like much. But if you read into it, you will see that they are seeking vendors for a, quote, web-based platform to support healthcare pricing comparison and bidding activity. That, combined with the CMS administrator's comments about price shopping, leads us to believe that CMS is plotting a move towards a retail-like model that allows patients to shop for healthcare services. We could be talking about the Cars.com for healthcare. It's not hard to connect the dots here. While the only named requirement so far is publishing standard charges online, this really appears to just be the first step, or the tip of the iceberg, in CMS's long-term intentions for pushing price transparency. So how are hospitals feeling about all of this? These stats came from a survey of 150 healthcare provider participants on a recent webinar we did in October. So if you're feeling concerned, you're not alone. 92% of healthcare providers are either somewhat or very concerned about how their charges will be perceived by the public. Now, one piece of this that may be getting overlooked is not only how patients will react to the charge master, but also the local media. The media has never had access to this type of data before, so I can almost guarantee that they will be all over this. Additionally, almost half of healthcare providers surveyed, or about 43%, didn't at the time know how they will address the mandate. And this stat is a little bit concerning in that only 29% plan to post additional pricing information beyond the charge master. So why is additional pricing information so important? And why is the pricing strategy needed? Well, here's what we know. 36% of healthcare consumers have price shopped either online or via a mobile app within the last year, according to a recent United Healthcare survey. And that number is only going to grow because half of the 72 million people in the millennial generation is now price shopping. The second statistic, which you already know, is because CMS is demanding it. 100% of hospitals will have to post 100% of their charges. Now, this third statistic actually surprised me a bit. 90% of patients said they do not feel obligated to stay with a healthcare provider who doesn't deliver an overall satisfactory digital experience. So your patients could just leave and go somewhere else. The big takeaway here is this. Without a pricing strategy, consumers will vote with their wallet, meaning they could switch providers. So this begs the question, what do you do as a healthcare provider to meet all these demands? Well, we believe that there are three different options, and we'll explore each one today. Option one is to simply export your CDM into a machine-readable format, such as Excel, and post it on your website. You can do this yourself and check the box, so to speak. This option is mandatory. But remember from the last FAQ that CMS pointed out in the new healthcare price transparency rules that they do not restrict a hospital from posting additional quality or price transparency information. In fact, the federal agency encouraged hospitals to provide consumer-friendly communication regarding hospital charges. So this brings us to option 2 and 3. Option 2 is to post your full CDM and also post comparative market charges. We know that charges on their own really mean nothing to the patient. If you post this information on your website, you can control the content and the ability for a consumer to view your MRI charges, for example, aligned with charges at other local hospitals, which may prevent inaccurate price comparisons. This at least helps you to start controlling the price message. The third option is to post your full CDM and then also provide patient estimates. Patient portion versus retail charges are often two very different numbers. An accurate estimate on your website that reflects the patient responsibility after the contractual discount and deductible will likely be much lower and provides actual value to patients. January 1st is the deadline to publish a list of standard prices in a machine-readable format. There is no getting around that, but there are things you can be doing today to get ahead of pricing transparency. First, you should know how your commodity pricing compares to the market. For items that are often price shopped, will you be the high-cost provider? This is really important to know. Then, before posting your CDM, it's important to consolidate your charge master into a single file that is machine readable, which also factors in pharmacy and supply items. Now, you may not have time to change your prices before January 1st, or you might think you can only change prices once per year based on payer contract language. However, the price transparency rule states you should update this information at least annually or more often as appropriate. So this means if you lower charges after January 1st, you can still push out updates at any time. For hospitals who do not want to submit price changes to payers, a revenue-neutral charge master adjustment is certainly an option and can help organizations focus improving commodity pricing without a revenue impact. Ashley will speak to this strategy more in just a minute. Taking control of the pricing message and allowing patients to determine their out-of-pocket costs through your hospital's website may not be a realistic goal for January 1st, but it can be a goal you start working toward right away. I've outlined some ways to get ahead of pricing transparency, and Ashley is now going to discuss those strategies and some other things going on in the market in more detail.
Thanks, Brad. It's clear CMS and consumers are pushing for transparency, but where do the payers fit in on this moving forward with pricing transparency? Well, as many of you know, hospitals haven't been real successful negotiating with their payers to be able to keep reimbursement neutral and lower charges. In fact, over the past month, I've heard of 2 scenarios where payers are entering a negotiation to let hospitals know that they're having trouble promoting their organization because their discounts aren't significant enough. So at a hospital, they may have adjusted or lowered their charge to be more price competitive, that may only have a 45% contractual discount versus the previous 65% discount. While reimbursement may be the same, the high charge gives the perception that there's a deeper discount for employer groups. There are counterintuitive components to pricing transparency, and there are competing objectives in the market. As healthcare providers consider lowering charges to be more price transparent, the changes that can impact large discounts that payers have and employers have become accustomed to. It will be interesting to see how payers deal with pricing transparency over the next year or 2. In the meantime, be aware that this type of message from the payer may undermine your pricing transparency strategy. It's further proof that while charges are the focus today, hospitals need to get to patient estimates that reflect the true costs that they will have to pay. And organizations need to start planning strategically on the integration of retail price or charges and discount price or allowable strategic model approach. This means an integrated strategy and an integrated model platform. Now we're going to launch our second poll question.
Thanks, Ashley. And that second poll question is, what is your level of concern about how your charges will be perceived by the public? And the options here are very concerned, somewhat concerned, or not concerned. Again, that question is, what is your level of concern about how your charges will be perceived by the public? The options are very concerned, somewhat concerned, or not concerned. And we'll, again, give everybody here about 30 seconds to vote. All right, and it looks like most of the audience has voted. So at this time, we're going to go ahead and take some questions from the audience. And if anybody on the call thinks of any questions, feel free to go ahead and enter those in the question tab in your GoToWebinar window, and we'll take them as they come in. So the first question, Ashley, if you could take this one, has CMS announced any further rules beyond January 1st?
That is a good question. Not to our knowledge, but CMS has made it very clear that they want more pricing transparency out there for patients. So it wouldn't surprise me to see more mandates like this in the future. I would say hospitals probably should consider this to be the first step of many, which is why it's so important to get ahead with this pricing strategy, not just the tactical step of posting the charges to check the box.
Yeah, that makes sense, Ashley. Thanks. The next question we have here, when CMS cites all charges, does this require professional prices?
That's a good question too. So the answer right now is no. At this time, we understand that the focus is on actually posting the technical charges or hospital charges. We haven't seen anything where CMS has referenced professional prices at this time.
Okay, thanks. And then we'll take one more question here before we continue with the presentation. And this is a good one as well. What are the most important things we should do before January 1st?
Sure. So there's really two things that everyone should do right now. One is to make sure that you do have a consolidated CDM to make sure that everything, which includes pharmacy and supplies, are standardized and available in that one document. And the second is to conduct a comparative market analysis to really understand how your facility charges compare to your local market. And really, you should be pushing those comparative charges online with your CDM to at least give your patients that idea of how you compare to others in your area.
Yeah, I agree with all that. Thanks, Ashley. And we will take more questions later in the presentation. We do have 2 more Q&A breaks scheduled, so feel free to enter any questions you might have during the webinar. And so at this time, we'll keep moving on.
Sounds good. Okay, so the transparency rule addresses charges, not prices. And this may drive consumers to focus on an item that is really irrelevant if taken at face value. So here are 3 words that are so simple yet confusing because they have completely different meanings for payers, providers, and consumers. So let's break down the charges versus prices. CMS is requiring hospitals to publish charges, but this isn't helping patients know what it's actually going to cost them. Most patients don't understand that retail charges are almost never paid. They also do not understand that the relationship among hospitals and payers can't make that connection, that charges are priced so high so that the payers can receive discounts. Let's take a real example of a CT abdomen and how that comparison of charges plays out. This example highlights conflicting material on the web, which is very confusing for patients and may misrepresent the hospital. So based on the charges, the medical center in this example looks over 30 times the price of the imaging center. This could be your organization. You have the opportunity to change that narrative. It's the patient's actual price is not often that significant if the insurance allowable, co-insurance, and co-payment is actually taken into account. So when applying the insurance information specific to the patient, the price difference is really about $100. The key for hospitals is to start to change this narrative and meet patients online as they're researching, doing their shopping. On the timeline we reviewed on the previous slide, we discussed the importance of knowing how your prices compare. This is something that you can do prior to January 1st. With consumerism on the rise, you need to know what procedures or items you are getting calls or complaints about. What items are being price shopped most frequently? Who are you competing with? Other hospitals or freestanding labs or radiology clinics? And lastly, procedures or services where you might be losing volume due to your charges. CMS data has been used internally by hospitals for years to compare hospital charges. So why not repurpose that data and educate your patients on charges at your hospital versus others? Showing charges at your hospital compared to other local hospitals and the statewide average charges better educates patients on than showing them what your CDM charges are. The price shopping can stop at your website. With CMS data, you can post heavily priced items such as MRIs to eliminate the need for patients to link data from various sources, risking an apples to oranges comparison. And if you don't feel good about your charges, you can change them. You don't have to wait until your next fiscal year. Most hospitals are changing prices without impacting revenue. The key here is to identify and prioritize your goals related to your market, cost, gross, and net revenue, and also understanding your patient mix and reimbursement to know how to best reach these goals. So we recently actually worked with Catholic Medical Center to balance their goals through a charge master adjustment project. This organization knows their commodity prices and how they look in the market. That being said, they were well prepared for the January 1st mandate. They're actively working with their state hospital association in New Hampshire to standardize what they are posting online. This hospital is confident that they're going to meet the requirements, and they want to be clear and concise to make sure that their patients are all getting the same message. One area that they're going to work on improving is their website. In order to offer a way for patients to be able to request an estimate online by entering their insurance information. The analogy that they used was like putting your house on the market. You have to get it cleaned up and ready to go before you can show it out to the public. And for this particular client, we looked at all services, including physician practices, supplies, and pharmacy, in addition to their hospital or technical charges. They had 3 clear goals. The first was to continue to be the low-cost, high-quality healthcare provider in New Hampshire. The second is to stay within 95% of the market. They were able to analyze local market data to map out pricing scenarios that allowed them to be able to do this. And lastly, they wanted to stay net revenue neutral. This required them to be strategic about where to lower and raise their charges in just a minute. I'll get to how they lowered their charges then. This hospital also collaborated with their pharmacy department with a goal of moving away from an average wholesale pricing and towards a markup formula based off of a cost. We worked with them through different pricing scenarios to allow them to meet their goal of remaining net revenue neutral. They then got internal feedback from their CFO in budgeting to choose the best scenario for them. One key factor to their success was comparing volumes to the previous year by CPT code to see what their highest priced services were. They also looked to see which services were price shopped the most by their patients, those commodity items, and which services got the most complaints from patients. All of this analysis allowed our client to determine the areas that they could lower their prices in order to remain net revenue neutral. And now we are going to launch our final poll question.
Thanks, Ashley. And that final poll question is, how are you planning to address the new CMS price transparency mandate by January 1st? The options here are to post standard charges only, to post standard charges with additional pricing information, other, or don't know yet. And again, that poll question is, how are you planning to address the new CMS price transparency mandate by January 1st? To post standard charges only, post standard charges with additional pricing information, other, or don't know yet? And we'll give everybody just a few more seconds here to vote. All right, thank you everyone for getting your votes in. And like I said, we'll distribute the poll results following today's webinar. So at this point, I'd like to take another break for questions. We've gotten a few more in here from the audience. So the first question we have here, Ashley, is how do Epic hospitals post all charges when Epic has pharmacy and supplies as shell records in the CDM?
Yeah, that also is a great question. So we see hospitals needing to pull out that detail to come up with your price for those with pharmacy and supply items. CMS was really clear that they're expecting hospital to post all CDM items. So we would look for organizations to pull that information out. And you'll probably have to do some analysis outside of your CDM to come up with that list price of services that you should be including with pharmacy and supplies.
Thanks, Ashley. And a similar question here, how do you recommend we handle pharmacy and supply charges that are based upon costs or formulary that can change often?
Yeah, so CMS actually noted in that FAQ document that you can update your prices more frequently than just once a year. The only requirement is that you have to update your list of prices on an annual basis. Obviously, as your cost changes and you have the flexibility to update what you post on your website, but you will be required to post all charges. For the items that are based upon a cost, you're going to have to review those and come up with a methodology that's explainable and defensible with what cost you're going to be using in terms of running that through your formula to be able to list your prices out from those items.
Thanks. And here's a question that I believe was referencing one of the graphs we looked at. Where can you find the information that was on that CMS side-by-side comparison slide?
Yep, so that information is from CMS Standard Analytical File. Most organizations use a MedPAR file. That standard file has an advantage in it that it's published quarterly and it runs about 2 to 3 quarters in arrears. So your CDM coordinator at your facility should have access to this data. It's also something that we, PMMC, actually purchases from CMS, and we can easily pull this data if you need to. So feel free to email Brad or myself if you want to have some of that information pulled for you. But again, keep in mind that it's publicly available data that you can get charges for any hospitals, or you can roll up to statewide averages or even national averages. But the key is to really make sure that you're presenting that comparative data in a way that conveys the message that you want for your facility.
Sounds good, thanks. And then this question is related to the Catholic example you shared, Ashley. Is there a case study document that you're able to share on Catholic?
Yeah, absolutely. We'll make sure to get that forwarded out to everybody at the end, along with the poll questions and answers. Okay, great.
And I think at this point, we'll keep moving on with the presentation. We do have one final Q&A break at the end. So if you do have any final questions that you think of, feel free to enter those and we'll take them at the end of the presentation. So now that we've gone through how to properly adjust charges, we can look at how to best present this pricing information to the patient online. So we know that digital expectations of consumers are really changing rapidly. From another recent webinar we conducted, we learned that there's a large gap today between online consumer expectations and what healthcare providers are actually offering today on their website. So for example, 47% of consumers now expect personalized service. However, only 7% of the attendees on the webinar that we surveyed were currently offering personalized patient estimates. So that's really now an expectation that we as a healthcare industry need to start embracing. I also mentioned earlier that 36% of patients have used either the internet or mobile apps in the past year to compare the quality and cost of medical services. But maybe the most impactful statistic is this: 1 in 10 patients said that they would actually switch healthcare providers after price shopping. So let's say your hospital averages 100,000 patients a year, and if we assume that 36% are price shopping, that's 36,000 of your patients. And of those 36,000, 10% could now go elsewhere. So you could potentially lose up to 3,600 patients a year just from price shopping alone. This is really the bottom line impact that we need to start taking seriously. So what do consumers want from their healthcare providers? Well, they used to just want to know, will I get better and how much will this cost? Now they want to know, how much will this cost me? Not only that, they want to know if it's a good deal. And that's why that 36% are price shopping. So for example, what am I going to pay for an MRI at your hospital versus the competition in your local market? And then finally, how do I get this without a hassle? You only have about 8 seconds to capture the consumer's attention on your website. So if they don't get the information they need right away, they'll become frustrated and simply move on, potentially to a competitor. Now let's look at an example of how to meet these new consumer demands. And keep in mind the points we just talked about and how this example addresses those points. So first and foremost, we need to capture the patient's demographics. Notice the option here for the preferred method of contact in this form. It's very subtle, but it puts the patient in control for how they want to be contacted, and it reinforces that point about personalization that I made earlier. Next up is the patient's insurance information, which is one of the key factors to producing an accurate estimate for that patient. We can now select a service and even compare multiple services. Personally, my favorite aspect of this example is that I can compare prices across this system's different facilities, so I can choose the best price based on my location. Again, it's personalized. If I'm especially price conscious, I might choose to drive a little further in order to save some money. For any health systems on the call today, this is definitely a key consideration. So in that estimate we just looked at, notice that we were given an exact dollar amount and not just a general price range. When we book flights or hotels, we don't want a price range. We want to know the exact amount we're going to have to pay today. The same applies for healthcare. It's also important to remember the data points that drive the accuracy to arrive at that exact dollar amount. When you're providing estimates to patients, it's important to remember these 4 factors: selecting the right service, selecting the right location, selecting the right insurance coverage or benefit information, and then the ability to calculate the contractual allowable amount. So, keeping everything in mind that we've talked about today, how do you bring this all together with the January 1st deadline looming? And how do you guide your patients to what's not only best for them, but what is also best for your organization? So I'm going to walk through a conceptual model of how you can guide your patients and control the price message. So let's start by looking at the message here. It's very simple. Know the cost of your healthcare. We mentioned that CMS requires us to publish standard charges, but that doesn't accurately reflect what it will cost the patient out of pocket. At the top of the page, which in marketing we call above the fold, we try to guide the patient to the most important information with a clear call to action. Get your estimate now. Now, if the patient chooses not to get an estimate now, that's okay. If they were to scroll down, they will now see how your hospital compares to the local market. Now, this isn't the most relevant information for them, but it still educates them about charges and at least gives them some context. Notice, however, that we're still attempting to guide the patient toward an estimate. So back to the CMS rule. We can still provide that list of standard charges that CMS requires, but notice that we've placed it at the bottom of the page. We really don't want patients to go here because it's really not the most helpful or relevant information to them. You can see here again that we are still trying to guide them to get an estimate. Notice that we've tried to guide the patient 4 different times to get that patient estimate, and we only link to the list of standard charges once. As long as you link to the list of charges in a machine-readable format that CMS outlined, you will have successfully met the requirement. So the bottom line here is that you have to post standard charges no matter what. Everyone on this call will be doing this on or before January 1st. We just believe there's a better way to educate your patients, and we want you as the healthcare provider to control the pricing narrative and not CMS. So with that, I'd like to open it up for any final questions. And Ashley, we do have a couple more questions here, if you wouldn't mind taking this one.
Sure.
So the question here is, what's the best way for our hospital to present patient estimates on our website?
Sure. So the example that Brad showed is definitely a conceptual model, but it's really up to you and your hospital how you want to present that pricing information and what's most important to your patient demographics. But I would say that there's probably 3 critical factors that you need to include. Being able to select the correct service, the correct location, if you have multiple locations in your hospital system, and for the patient to be able to select their correct insurance or benefit information. With those 3 things, it's really going to be able to drive that accurate estimate back to the patient.
Thanks, Ashley. Another question we have here, when CMS cites all charges, does that mean a rehab outpatient charge if it's just a separate location?
Yep, you're still going to need to list all of your charges. If you have a separate location that's part of the hospital, like a freestanding center, you're still going to need to list those charges as well.
Okay, thanks, Ashley. And it looks like we've gotten through all of our audience questions today. And I do think we had a lot of good questions. Some of them were a little bit more tactical relating to the rule. But I think the big takeaway here is that everybody is going to have to adhere to this mandate by January 1st. But it really does go beyond just posting the standard charge master. It's really important to think ahead and have a strategy and think about what the implications are for posting just the standard charge master alone, and really think about what is most meaningful and relevant for your patients.
Yeah, I couldn't agree more. I think everyone needs to be prepared over the next few weeks to address that tactical step to check the box to post your CDM file. However, the bigger picture is, and you hit it the nail on the head, is we need to be looking as an industry and as healthcare providers of how do we come up with a strategy that addresses that critical piece of not just the pricing transparency, but really making sure the information we're providing to our patients or the consumer is exactly what they're looking for. And that piece, what something costs me as an individual, is going to be that relevant factor that we're really going to be focusing on as we move towards 2019.